Councilwoman Beatty. Next up is Congresswoman Sarah McBride from Delaware.
Thank you very much, Madam Chair, for convening us. Thank you so much to all of the witnesses for your experience and your expertise that you're sharing today. Right now, tens of thousands of Delaware families are staring down a 1-2 punch, a Republican shutdown and a Republican healthcare crisis that would send healthcare premiums skyrocketing. Let's be clear. These avoidable premium hikes are a Republican tax increase by another name. And they are a tax increase on everyday Delawareans to fill the piggy bank that Donald Trump is using to pay off billionaire donors who are facilitating his abuse of power. In Delaware, nearly 46,000 of my constituents rely on premium tax credits to afford coverage, an average of $588 a month in savings, totaling more than $320 million a year in savings for families across my state. That is what is at stake in this shutdown. Take a retired couple in Sussex County. Right now, they pay about $77 a month for coverage. In the healthcare crisis we're barreling toward, that will jump to $206 a month. That's $1,500 a year just to see a doctor for a retiree on a fixed income. A middle-class family of 4 in Middletown, Delaware could see their yearly health premiums jump by over $10,000. These families can't afford for us to wait to solve this health crisis. But Republican politicians are painting this as a Sophie's choice, that we have to pick between keeping premiums from skyrocketing or paying our federal workers. That is a false choice. We can do both, and we must do both. There's no reason we can't keep this government running and address skyrocketing healthcare bills at the same time, because treating people with respect means keeping the lights on and keeping healthcare premiums low. When I sought this seat, I said I would work with anyone to deliver for Delaware, and I would stand up to anyone who was hurting Delaware. We remain here at the negotiating table, ready for Republicans to do their jobs. But they shouldn't think for a second that I or my Democratic colleagues won't fight to defend people's health care every step of the way. And as Ms. Holcomb mentioned, we are fighting for health care for all. Healthcare for Democrats, Republicans, independents, healthcare for people who voted for us in the last election, and healthcare for people who didn't vote for us in the last election. Because we are here to serve everyone and to fight for everyone. And with that, Madam Chair, I yield back.
Thank you, Congresswoman McBride.